Imagine waking up one morning to find an extra $1,226 in your bank account. Now picture that happening every single month. For one small business owner, this wasn't a dream. It was the reality NJ Life and Health created through a Medicare Makeover. In this video, we'll detail how we helped our client go from paying $1,900 a month through his work insurance to $674 a month by transitioning to Medicare, all while maintaining amazing health coverage. This is the story of how a simple review turned into a game-changing financial win and why you need the right insurance partner in your corner. Let's dive in. Quick note, the most important thing to NJ Life and Health is our client's privacy. The situation and numbers are real, but all personal information such as names have been changed to maintain confidentiality. Steve is a 65-year-old small business owner. He appreciates his hardworking employees and rewards them with great healthcare coverage. But he got a shocking notice that his personal health insurance premiums through his company's health insurance plan were going to up to $1,900 a month. This was on top of deductibles and copays and other out-of-pocket costs, so something had to give. So he reached out to the brokers at NJ Life and Health. Our goal was to substantially lower his monthly premiums while maintaining great healthcare coverage he could be confident in. Now that we understand Steve's situation, let's break down his costs under Medicare to see how they compare. Steve had already enrolled in Medicare Part A when he turned 65. We had helped him delay taking Part B just a year ago. If you want to watch that video, I'll link it down below. If we were going to transition him to Medicare, we would have to see what Medicare Part B would cost him. Most Medicare enrollees pay $174.70 a month for Medicare Part B coverage. This is money you pay directly to the government, not a broker like us. But Steve's situation was different. Because of his income, he was going to pay a little bit more. Steve was accruing IRMAA charges. IRMAA is IRMAA, and it stands for Income Related Monthly Adjustment Amount. It is an extra charge added to Medicare premiums for those in higher income brackets. In Steve's case, this increases Part B cost from $174.70 a month to $454.20 a month. Now, if you're watching this video and you're worried about accruing IRMAA charges, don't fret. IRMAA charges are rare and in most cases only last a short period of time. Chances are your Part B cost will be the standard $174.70 a month. To recap, we are trying to lower Steve's cost from $1,900 a month to something much lower while maintaining great coverage. His first Medicare cost is $454.20. So even with the increase, we are still well under budget. But there are two more costs we must factor in. With the basic Medicare cost calculated, we then moved to address the gaps in Medicare coverage to ensure Steve was fully protected. Original Medicare by itself is fantastic, but has some major gaps in coverage. These include high deductibles, copays, and most importantly, a 20% coinsurance on all covered medical procedures. There is no cap on these costs, so a catastrophic year could quickly give you catastrophic medical bills. We had to cover these gaps. There are several options available for addressing these Medigaps. You could choose a Medicare Supplement, often referred to as a Medigap Plan, or you could choose a Medicare Advantage plan. Choosing between these options is a big decision, but Steve decided a Medicare Supplement was the right choice for his needs. Out of all the Medicare supplements available, Steve chose a Medicare Supplement Plan G. This plan would cap his hospital and medical costs at $240 per calendar year and allow him to use any Medicare doctor. We found a Plan G in his area for just $166 a month. And just know the cost of a Plan G varies greatly depending on your location, age, and gender. To bring you back to the scoreboard, Steve's original monthly premium was $1,900 a month. Our analysis showed that his Part B cost would be $454.20 a month, and his Medigap Plan G would cost him $166 a month, bringing his total $620.20 a month. Being on original Medicare meant that he could go to 98.9% of physicians and hospitals across the country, according to Kaiser Family Foundation. He also would have very little, if any, pushback for medical procedures by way of prior authorizations, denials, and referrals. On top of all that, his Medigap Plan G will cap his hospital and medical costs at $240 each calendar year. Not bad. But there is one more cost we had to factor in: prescriptions. Steve was only on a handful of generic medications, so we knew his prescription costs would be low. When we looked up prescription plans in his area, we found a standalone Part D plan that was $0 per month, and the copays for his particular generic medications were $0 to $4 each time he went for a fill-up. This meant his costs would be low, but there was a twist. IRMAA charges unfortunately came back into the picture. Not only can IRMAA be applied to Part B, but it can also be applied to Part D. Steve's Part D costs were going to be raised to $53.80 a month. Again, these charges are rare, and even if you do manage to accrue them, they are often temporary. Steve's new costs were now $454.20 for Medicare Part B, $166 for his Medicare Supplement Plan G, and $53.80 for Medicare Part D. Again, this is raised due to IRMAA. It should be $0. But all in all, this brought his new total to $674 a month. We were able to save him $1,226 a month while maintaining amazing health coverage. There is also the potential that those costs will go down even further if his IRMAA goes away or is reduced in the future. The decision to switch to Medicare was an absolute no-brainer, but we weren't done yet. With the financial aspects sorted out, we still had one crucial step to complete: navigating the paperwork to make this transition official. Steve needed two government forms, CMS 40B and CMS L564. I'm going to link both of them below if you need them. CMS 40B is the Part B enrollment form. Steve filled it out with his basic information, Medicare number, and requested start date for Part B. This form tells Social Security and Medicare that Steve wants to start his Part B coverage. CMS L564 verifies that Steve had creditable work insurance while eligible for Part B. This form serves two purposes. It helps avoid penalties by proving continuous creditable health insurance coverage, and it allows enrollment in Medicare Part B outside the usual enrollment periods when you do lose your work insurance. Since Steve owned his own business, he was able to fill out CMS L564 himself. If you're an employee, you would have to have your HR department or boss fill it out and return it to you. Once Steve gathered all his forms, he submitted both forms in person at his local Social Security office. While there are other submission methods, we find this to be the most efficient. After the forms were submitted, we signed him up for his Medicare Supplement Plan G and his Part D prescription plan. The transition to Medicare was complete. Now let's bring it all together. Steve was a small business owner, and he was facing $1,900 in monthly premiums for his own personal health insurance through the company that he owned. Despite higher than normal Medicare costs due to his income, these IRMAA charges we kept bringing up, we provided him with comprehensive health coverage for just $674 a month through a Medicare Makeover. This saved him $1,226 each month. With our guidance through some basic government paperwork, Steve's transition to Medicare was quick and seamless. He maintained excellent coverage while dramatically reducing his costs. Now, if you'd like your own Medicare Makeover or evaluation of your insurance options, reach out to the brokers at NJ Life and Health. We will give you a no-cost evaluation of your insurance situation and always have your best interest at heart. If it makes sense to stay on your work insurance, we will absolutely tell you. Find out if you could save hundreds or thousands just like Steve on your insurance, and don't leave any money on the table. Contact us today for your free Medicare evaluation. You can do so by calling our Toms River, New Jersey office at 848-226-6897, or you can visit our website at www.njlifeandhealth.com. For more Medicare makeovers, videos explaining Medicare, and our awesome podcast Talking Retirement, check out the hundreds of other videos on NJ Life and Health's YouTube channel. Once again, I'm your Medicare guy, Ken, and this has been a Medicare Makeover. We will see you in the next video.